Welcome to SVG-TV News for Monday, January 18th, 2021. I am Rochelle Batiste with the details. St. Vincent and the Grenadines today, Monday, January 18, 2021, recorded a second COVID-19 death, that of an 80-year-old man. The first death recorded on Friday, January 15th, was a 49-year-old female. In a recorded statement from Chief Medical Officer Dr. Simone Keyser Beach today, she said both patients were admitted on separate days to the Milton Cato Memorial Hospital with pre-existing conditions.
Gentleman presented with chronic non-communicable diseases and deteriorated over the weekend. Sadly, at 4:30 this morning, he died. On admission, during routine screening, he was found to be COVID-19. This gentleman is the second COVID death for St. Vincent and the Grenadines, as I mentioned, the first being a 47-year-old female who presented to the health services on Thursday, January 14. The adult female had pre-existing conditions, also diabetes, hypertension, and presented to the health services in a very unstable state, deteriorated rapidly, and later died at the Milton Cato Memorial Hospital on the 15th of January.
The CMO used the opportunity to extend condolences to the two families on behalf of the Ministry of Health, Wellness and the Environment. Meanwhile, on radio on Sunday, Prime Minister Dr. Ralph Gonsalves expressed his condolences to the family of the 49-year-old woman recorded as SVG's first COVID-19 death.
First death for us, COVID. I knew Justina, of course, is Archbishop Pompey's sister. And I paid my respects to him and the family already by telephoning him. And of course, as he, without any prompting or anything, told me that Justina had really serious pre-existing conditions. We don't need to mention them, and the press release did address serious pre-existing conditions. She's a good and gentle soul.
Also on Sunday, January 17, 2021, SVG recorded 60 new COVID-19 cases, all of which are nationals with no history of recent travel. The National Emergency Management Organization, NEMO, said in a news release 5 of the cases were detected during contact tracing, testing of persons with flu-like symptoms, and general screening. 11 cases were detected during exit screening. On Friday evening, 62 new cases were confirmed. 1 adult non-national arrived with a negative PCR test and tested positive on arrival. All of the other 61 cases are nationals with no history of recent travel. These cases were detected during contact tracing, testing of persons with flu-like symptoms, and exit screening. There are now 358 local cases under investigation. Cases range in age from 4 to 87 years. Most cases are located on mainland St. Vincent, with the highest numbers in the Pembroke Health District. 118 persons have recovered. 375 cases remain active, and 2 persons with COVID-19 has died. 494 cases of COVID-19 have been reported in St. Vincent and the Grenadines so far. NEMO said all positive cases will continue to be isolated until cleared after 14 symptom-free days and a negative PCR test result, noting that this change in the criteria for clearance is supported by guidance from the WHO. Persons who have been instructed to quarantine while awaiting their results are advised not to leave their quarantine sites until their test results have been received. NEMO said persons who fall in this category will be served with a medical officer's order and granted sick leave, and employers are advised not to encourage their employees to break their quarantine orders. In related news, The World Health Organization, the WHO, today indicated on its COVID-19 dashboard that SVG has community transmission. As described by the WHO and other health organizations, community transmission is evident by the inability to relate confirmed cases through chains of transmission for a large number of cases. WHO has 3 classifications for COVID-19 transmission: sporadic clusters of cases and community transmission. Meanwhile, in her recorded statement issued today to the media, Chief Medical Officer Dr. Simone Keyser-Beach did not address the WHO's community transmission classification of SVG. However, she noted that cases of COVID-19 have been recorded in all health districts across SVG.
There are cases of COVID-19 throughout St. Vincent and the Grenadines. Therefore, we are seeing persons in the North Windward Health District, which will be Georgetown, in the North Leeward Health District, which will be Chateaubelair, the South Leeward Health District, which will be Pembroke, and also the Calico Health District, the Mesopotamia Health District, Cedars Health District, Northern Grenadines, and Southern Grenadines.
The CMO also sought to clarify what was stated in an earlier news release, which indicated that the highest number of cases were recorded in the Pembroke Health District.
Aware of the fact that the release which stated that we were seeing the largest numbers in the Pembroke Health District, which includes Layou, it includes Bookament, those numbers refer to where persons live and not where persons got their tests. However, as I said, there are cases throughout St. Vincent and the Grenadines, and persons should be cautious wherever they go. That is why we are saying you should wear your mask. It does not matter if you are in the Pembroke District, the Maraqua District, the Cedars District, the Georgetown District. Wherever you are in St. Vincent and the Grenadines, we are seeing cases from your district.
Meanwhile, the CMO is reminding all persons with chronic non-communicable diseases to pay more attention to their health as they remain vulnerable to COVID-19. The 2 deaths recorded from COVID-19 had diabetes and hypertension. The CMO said that persons with these underlying conditions tend to have poor outcomes once they contract the virus,
such as diabetes, hypertension, chronic renal disease, sickle cell anemia, also persons who might have SLE. Any disease that persons have to deal with for a prolonged period of time that cannot be cured, but rather controlled. And therefore, it is extremely important that those persons with such conditions maintain good control of their conditions as possible. If you are diabetic, please do not forget your medication. Please stick with your diet. Please continue to exercise as possible. If you are hypertensive, also please continue to take your medication and make sure your blood pressure is well controlled, including using diet and exercise.
The CMO also reminded persons to protect themselves by wearing a mask. This also applies to the elderly who are among the vulnerable groups.
Family members of such persons, when they are out and about, also need to be very careful about wearing a mask. That way, they can protect their loved ones so they don't get it, they don't bring it into the home. And there are other interventions that can be used while in the home. If you are particularly worried, if you feel you might have been exposed to COVID-19 and you have a loved one in the home who is elderly or who has non-communicable diseases such as diabetes or hypertension, you should continue to use your mask in the home whenever you are close to such persons or when you are taking care of those persons if those persons need your assistance for their daily activities.
Another vulnerable group is the frontline workers, particularly the nurses, who are encouraged to decrease contact with persons indoor and outdoor. President of the SVG Diabetic and Hypertension Association, Rosita King, is also encouraging diabetics and persons with other health conditions to adhere to the COVID-19 protocols and guidelines by the Ministry of Health, Wellness and the Environment. Persons living with underlying conditions such as diabetes, hypertension, heart and lung disease, sickle cell, obesity, a weakened immune system, chronic kidney or liver disease, and cancers are at a high risk of developing dangerous symptoms if become infected with the coronavirus. In a telephone interview with SVG-TV News today, King encouraged the elderly and persons who are suffering with these illnesses to avoid leaving their homes, and if they do, they should wear a mask.
Frequently, regularly is a must. And you have to avoid touching your face or surfaces that may carry COVID-19, which means, again, you have to go back to wash your hands once you have touched surface that may carry COVID. Again, you have to stay away from anyone who you know is sick. Ask family members and friends who are sick. Kindly ask them not to visit you, to phone you, use WhatsApp. The media is there. To stay away or to stand, if you're having a conversation with anyone, 3 to 6 feet. That is basically, outside your premises, or if you have to visit your health center. And I will advise you, I know that you have to go out to get your groceries. If you don't have to, you can send family members to do that. If you have to do that, you know that you have to protect yourself with your face mask.
Diabetics are also encouraged to take their medication as prescribed and to purchase, if they can, on their own machine to monitor the blood pressure and glucose levels at home.
It is also important that you maintain your taking your medication regular as prescribed. It is important that as a diabetic that you keep all your medication at home. So at least you should have your 3-month supply, and if you're running out, you know how you should get your supplies. It is important that you keep your supplies and do not run out on those things. Drink lots of water to help to regulate your blood sugars. And one of the important things I must mention, that your daily routine of doing your blood sugars, either before, after, whatever you practice to do, please maintain that.
The president of the SVG Diabetic and Hypertension Association said diabetics and other persons should also ensure they eat healthy meals, especially during this time, to boost their immune system, and also to take vitamin C supplement.
Do not forget to take, in relation to your meals, your nutrition is very important for you to maintain or enhance your immune system. So you have to have a variety of balanced meal. So you have to make sure that that is done. And, foods that are low in glycemic index, things like vegetables, whole wheat, noodles, avoid excessive frying. So you can choose other method. Steaming, baking, limit food that is high in sugars and carbohydrates and fat.
A male in his early 20s who recently tested positive for COVID-19 here said he has been experiencing mild symptoms and does not like the feeling. The COVID-19 patient, who is now isolated at home, shared his experience with our news team via telephone interview, but we of course distorted his voice to protect his identity. The patient said that after some of his colleagues tested positive for COVID-19, he did a rapid test, which was negative, but a few days later, he started feeling ill and went to get a PCR test done, and the result came back positive.
My experience with COVID-19, right? Well, first started, when I start experiencing dry mouth symptoms, like, and also headaches and so forth, right? So my skin started to feel like, okay, it was feeling less in my skin, and the skin felt thick, as if like I had like dead skin. That is what I was experiencing. And I had a chest ache. I was wondering if it was just like muscle pain from exercising, but it wasn't like that. After I heard some colleagues of mine having the COVID-19, which I was in contact of, I got a bit worried and I went to the doctor and tested.
The COVID-19 patient is encouraging persons to follow all of the protocols and guidelines and to try to get tested if experiencing any flu-like symptoms or if knowingly you are in contact with a COVID-19 patient.
You experience flu-like symptoms such as cold, fever, and so forth. But it's one of the worst feelings you can experience as a human being this day and age. Trust me, and if you're experiencing symptoms as I experience, I think you should go to a doctor and check out yourself immediately and know your status.
And infectious disease specialist and member of the SVG COVID-19 task force, Dr. Gerald Thompson, in a telephone interview today with SVG-TV News, shed some light on why persons who contract COVID-19 respond in varying ways. He says the responsiveness of the immune system with its white blood cells and antibodies is the root of the issue.
Cells, and there are these antibodies that are produced as a response. Now, persons whose white blood cell, these T-cell response, occurs very quickly during the time that the virus is incubating and can recognize that there's a foreign object, a foreign virus in the system, will fight off the virus and get rid of it or try and suppress it early. Those individuals whose immune system is more sluggish, slower, or delayed, they will allow the virus to dig in and cause a more severe infection, which by the time the immune system starts to respond, it has already taken some root and some hold.
Dr. Thompson also went on to explain why persons with non-communicable diseases are at increased risk of experiencing severe symptoms of COVID-19.
Persons with non-communicable diseases like cancer, diabetes, hypertension, arthritis, their immune system would be quite dull. Matter of fact, for diabetics, the higher someone's blood sugar is, the more suppressed are your white blood cells and your immune system. As you get older, your immune system also tends to fade and slow down. And so persons over the age of 70 and 80, they too are going to be at higher risk. So besides being aged, also have diabetes, hypertension, had it for a long time. They are also going to be more at risk for a more severe infection if they are to get it.
The infectious disease specialist said while persons can use natural remedies to boost their immune system, they need also to equip their bodies with the right tools to fight COVID, which is through a vaccine.
It's true that you can boost your immune system by taking things like turmeric, ginger, garlic, and the list is long. Those things do help to boost your immune system. But the best way to boost your immune system is by receiving a vaccine. when it eventually comes out, such that if your immune system is now primed and you are then exposed to the virus later, your immune system is ready for that virus with pounce on it.
Dr. Thompson continues to encourage persons to follow the safety protocols to slow the spread of COVID-19.
Time in particular, we need people to start to wear their mask properly, to wash hands, to really look at that distancing. No, encouraging our intention that in spite of what the sad loss of life, that we have to continue to chart a course through this pandemic.
And just to announce that Prime Minister Dr. Ralph Gonsalves will deliver an address to the nation at 8 this evening. The address will be carried on SVG-TV, NBC Radio, and VC3. The address would also be carried on the Facebook pages of several media entities, including NBC Radio and the Agency for Public Information. Please note that due to this address by Prime Minister Gonsalves, there will be no encounter and the Law and You programs on SVG-TV this evening. There is no explosive eruption at the La Soufrière volcano at this time. This has been made clear in the last update provided by the National Emergency Management Organization, NEMO, after several communities in the red and orange zones of the volcano went into a panic mode on Saturday night after seeing what appears to be fire coming from the volcano. NEMO noted that La Soufrière continues to have effusive eruptions as hot magma reaches the surface at extreme temperatures. This appears in the night as fire or a bright red glow above the crater. It further noted that as the new dome gets higher and closer to the rim of the crater, this phenomenon or red glowing lights will continue to be visible on clear nights. The team of scientists monitoring the volcano had to fly over with a helicopter Sunday, and according to the lead scientist, Dr. Richard Robertson, it was observed that there was a large portion of vegetation burnt, which could have been what persons were seeing on Saturday night. He, however, noted that this observation is being revised for final analysis.
The thinking was on the weekend when 4 people saw the fire. This was it, and because that's possible. But what in observations that we've made since then is that we've seen there's an area in the crater on the western side where there's a long run out of damaged vegetation. It looks like there was a huge bushfire there. We saw that the day after. So one of the other possibilities for the fire and the glow that people saw, and again, one of the possibilities going forward, is that you can have fires inside there because you have hot material and you have vegetation, and the vegetation burns. And because of the amount of vegetation, amount of heat, they can actually burn for a little while. There's evidence that there was a huge fire in there on that same Saturday night, and that might have been also the thing that people saw, because from my understanding, it didn't really, if there was a glow, it should have probably gone on for the whole night, say. But that's not to say the glow can't happen. So in summary, the dome continues to grow. It continues to interact with the crater walls, the pre-existing dome, and also the crater floor. And in that interaction, because of the heat, because of the high temperatures, it's causing burns, it's causing fires.
Mid-morning on Saturday, Dr. Robinson said he went into the crater and collected a bucket of rocks for samples. He said that geochemical analysis and other tests on these rocks will have to be done overseas, which will take some time. Crystals were found in the rocks, and according to Dr. Robertson, preliminary analysis using hand specimens indicate that the new dome is forming independently of the 1979 dome.
We'll have to look at more studies. It seems to me that there's been some mixing. The crystals suggest that they're coming from a chamber that's not too happy. It's not in what we call equilibrium with itself, and that disequilibrium is what is helping it to get out and force it out. So the material that we have essentially indicates that this is new stuff. It involves new stuff. It's not something left over from a previous, say, eruption. It's a new eruption in its own right. That has implications for, possibly it might mean that it could go on and develop on its own way. It could go on for longer. It could mean that it could do different things, but it means that it's not a leftover. It's its own thing. And that's kind of the thing that we've seen in terms of the rocks so far.
Meanwhile, Dr. Robertson said he is pleased with the services of the Rotary helicopter, which is here for 1 week and is being properly utilized. The aircraft work will finish here on Wednesday, January 20th.
It was to help us to get a stationary summit. That was completed today. It was to help us to get a rock sample and to do some measurements in the crater. That was completed already. It was to help us to collect gas measurements. That's being done and has been done. It was to help us to get a good DEM a better accurate DEM of the dome. That's been done also. There are a couple other things we'd make use of it for. We've been using it for observations all the time, so we're able to track the dome much more carefully over the last couple of days. We hope to do something about putting up a camera that will help us take pictures for helping to track the dome. We're hoping to perhaps put in a reflector, a particular instrument that would help us to track the movement of particular parts of the crater walls. But those were less critical things. The most critical things that the helicopter came for has actually been done.
Meanwhile, NEMO continues to remind the public that no evacuation order or notice has been issued. It also continues to appeal to the public to desist from visiting the volcano, especially going into the crater, since doing so is extremely dangerous. In other news, St. Vincent and the Grenadines is ranked 59th in the 2020 Economic Freedom Index with a score of 66.8. SVG is ranked 10th among 32 countries in the Americas region, and its overall score is well above the regional and world averages. Barbados is ranked 92, Jamaica 49th, St. Lucia 50, and the Bahamas 69th. The top 10 ranking states considered to have the most free economies are Singapore, Hong Kong, New Zealand, Australia, Switzerland, Ireland, the UK, Denmark, Canada, and Estonia. SVG's economy has been considered moderately free since its first grading in the index in 2009. GDP growth for the past 5 years has been tepid. The index report noted that many fundamentals for greater economic freedom, such as flexible regulations and efficient legal system that secures private property and macroeconomic stability, are in place. It, however, noted that greater access to private financing and more openness to trade and international investment would improve the country's business climate, and the establishment of a specialized national anti-corruption agency would improve government's integrity. The annual report, which is published by the Washington-based think tank, the Heritage Foundation, examines countries' economic policy development. The report grades and ranks countries by measuring economic freedom based on 12 qualitative and quantitative factors grouped into 4 pillars: rule of law, government size, regulatory efficiency, and open market. Royal Caribbean Cruise Line has added St. Vincent and the Grenadines to its 2021 schedule as new ports of call in the Windward Islands. Barbados has been named as its new home port. The cruise line is preparing to return to the high seas after the COVID-19 pandemic brought the cruising industry to a standstill. Royal Caribbean's Grandeur of the Sea is expected to recommence sailing in December. President and CEO of Royal Caribbean International, Michael Bailey, said that the new home port in Barbados will help to unlock new memorable vacations to share with family and friends in breathtaking places. The new itineraries all depart on Sundays. They include a 7-night Southern Caribbean island hop, a 7-night Southern Caribbean adventure, and a 14-night ultimate Caribbean voyage. Last week, Royal Caribbean said it was extended its cruise suspension for most of its ships through April 30th, 2021. The company and other cruise lines have been working to meet the requirements of the U.S. Centers for Disease Control and Prevention in order to return their ships to service. To show that they are ready, the cruise lines will need to run mock voyage with volunteer passengers. Last month, Royal Caribbean said that more than 150,000 people have offered to volunteer as passengers for any trial cruises. The Royal St. Vincent and the Grenadines Police Force is advising the general public about a scam that is currently being perpetrated via WhatsApp, purportedly on behalf of Samsung. A news release from the police says some users of WhatsApp, a multi-messaging platform, have received messages from one Sarah Davis using telephone number 880-1629-845652. Davis purports to be a Samsung Promo Active online agent. The content of the messages states that the Samsung company is currently running a promotional program for WhatsApp members worldwide, and participants were selected through random selection in Samsung's database computerized system. According to Sarah Davis, WhatsApp users from Africa, America, Asia, Australia, Canada, Europe, the Middle East, the Bahamas, New Zealand, Jamaica, St. Kitts and Nevis, Haiti, Turks and Caicos was selected through random selection in the Samsung's database computerized system. The police said the message further informed recipients that they were among the lucky winners with a grand prize of $100,000 and that they needed to make a claim to receive their prize. A claim form with a fake Samsung letterhead was also provided by Davis. The form requests the following information from persons: full name, the phone number, your home address, email address, a date of birth, nationality, occupation, next of kin, country of residence. The RSVG Police Force is advising the public not to share any information or cooperate in any way with Sarah Davis, as her proposition is a scam. In other news, the Roads, Buildings and General Services Authority, BRAXA, said it has completed the upgrade of Barrymore Road, commonly known as the Arnorsville Fountain Link Road in West St. George. The company said the project saw the construction of 328 feet of road along with slipper drains. In addition, it constructed a 100 feet long retaining wall. BRAXA said the project was done at a cost of $166,000 EC and was carried out over an 8 weeks period.